it's also re-engaged a lot of people who've been out of care for a long time, and they find us and they think it's that the center has their own clinic, but they don't realize that it's also connected with a Huntridge Family Clinic. And then when they follow up and they see us at the main office, they realize they're in care, and it's finally a good thing for them, and they stay in care. It helps the community with people who don't have insurance. They can come in here, they can get tested, they can be seen, they can be treated without worrying about getting a bill for what was done here, because we want to make sure that there's less barriers and more bridges to healthcare than there are already placed. The health center helps a lot of people, especially in our community, get on PrEP. It also gets a lot of people who are HIV positive and didn't know they were HIV positive into care. It's a great linkage for those who are drug users here at the center.
One of the really amazing things about the center is it's open to anybody. We get patients from all walks of life. And one of the great things about the center and the patients that we take care of here is we do a really good job of trying to be as inclusive as possible and trying to take away that preconceived, that notion that like this is just for individuals of the LGBT community. We see our allies, we see heterosexual people, and we do a lot of walk-in traffic. We do a lot of homeless services through the center and through the clinic, and provide a lot of outreach care.
I'm always in the community. The people that I serve, they're so amazing. A lot of the people that we come into contact with, they do misuse substances, or they're just at risk for being homeless. And so we like to meet those individuals and let them know that we're here for them. We meet people where they're at. If they're not ready to stop using, then we meet them where they're at and tell them how to use safely. It is a home for the community, not just the LGBT community, but to all communities, because we all have a family member or a friend that can identify, but we all need access to resources, and we all need the support of one another to make this community whole.
I think it's also really important to know not only do we serve the LGBTQIA+ community, but we also serve the under-resourced communities here in the Valley. So the main goal of our capital campaign is expansion, be it in our current footprint or in the surrounding area around us. The goal is to build the infrastructure that we need to meet the demand that continues to grow here in the Valley. The investment from Sands Cares has been instrumental this last year in helping us to, one, expand our hours and services, which in turn expands our testing, which is so vitally needed here in Southern Nevada. And it's also allowed us to expand our clinical and medical staff to meet the needs of the demand that continues to rise. What we're excited about is an in-house pharmacy. That will do two things for us. One, for our clients in the clinic, will allow us to walk them over, get their prescriptions filled on site, in hand, and send them on their way with everything they need to be successful in their journey. And second, that there is a huge need in the community around us in which we set in for pharmacy services. There's not much in this area for them, and we think it's vitally important to help out the community as well as our clients here in the center.